everything might not be fun.
Yeah, the politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense? We'll figure it out.
This is the thing. I'm just getting totally unhinged now, and I don't know what to do. Wait. A little wet.
A little bit. It's a great day, though.
Great day. It's actually not so humid, so it's good. And the trails are good. So I wanted to talk about a couple things with you. I don't know if you saw my last podcast.
I did, yeah.
So I kind of blamed everything on the doctors. I threw it on the tails of the doctors because we're the ones, when it comes right down into it, who order the tests, who write the prescriptions, and who tell our patients what to do. We give the advice.
Yeah, and then, some of it is our fault. That we, the kids of our elderly parents, are pushing you, and I know that you're being pushed by some regulations too.
Right.
Insurance companies want to see certain things, and Medicare and Medicaid have metrics that the drug companies have fudged, which would be a good thing to talk about sometime.
Well, yeah, the drug company fudging is always good. Everything we know has been fudged by the drug.
Yeah, can we divert? I mean, the scorecard. But you were telling me that. So my father's been in and out of the hospital a couple times, and they've got this questionnaire with a frowny face to smiley face grade about how well did we manage your pain, and it's like, I know from the quality management stuff that you get taught at work that you get what you measure, and you start measuring pain. And then that's going to make the drugs flow.
Yeah, you measure pain, then you got to treat the pain. And that created
it's a performance measure.
In fact, the drug company that makes OxyContin, the most infamous narcotic, invented that metric with the smiley faces.
Yeah.
To make people not have smiley faces, because very few of us have smiley faces most of the time. And then we wanted to have some OxyContin.
We want smiley face.
We want the smiley face. So we'll take a drug. And that's the whole drug industry, is to give everyone a smiley face. Yeah. That's what we're all trying to do. And so we as doctors are pushed by that. And so someone wrote an email to me about my last podcast and said, look, you can't blame the doctors because the doctors have these scorecards. If they don't get the blood pressure below a certain amount, if they don't order a mammogram for everyone, they got scorecards for all this stuff. And so what are they going to do? And I've been saying that all along. I agree. But who creates those scorecards? Is it the insurance companies?
It's a small pool of doctors.
It's a small pool of doctors. Which kind of doctors create those scorecards? Specialist doctors in specialist societies. The most onerous scorecards that I know of, the ones that tell me I have to put a 100-year-old on a cholesterol medicine, are created by the American College of Cardiology. American College of Cardiology creates the most ignorant scorecards out there, and everyone thinks that we have to use them. So the doctors are creating the scorecards. Yeah. When I blame the doctors, I blame the doctors.
So I think that, well, what is the right answer? Those doctors have a microscopic view. I mean, everybody who is a hammer thinks everything is a nail, and that everyone is going to see, oh, I'm a cardiologist and I'm going to treat your problem. I'm going to make sure you don't die of a heart attack. You might die of liver failure because I overdrugged you, but as long as you don't die of a heart attack, I've done my job. And maybe
even if there's no evidence.
Maybe the problem is that there's too few doctors that are making those scorecards, and that it's not a bigger macroscopic view. It's so microscopic.
But these doctors, for instance, the cardiologists who say everyone should be on a statin, there's not a single study that would support what they say. So they're just saying, because they're experts, we don't need a study. We're experts. And then everyone believes it.
It's something that they can do, and it's human nature. They want to help, and that's something that they think is
smiley
helpful.
face. I got the smiley face because I'm on a cholesterol medicine, so now I'm going to live forever. And look, Mrs. Jones is on a cholesterol medicine, and she's 95.
Yeah.
They don't look at 20,000 other people who aren't on cholesterol medicines who are also 95. So there is a bright spot that happens.
What is the bright spot?
that smiley face.
We like smiley faces. I'd really love to be on drugs every day, I think.
But
I've
different,
never tried it.
A non-drug. I've never been on drug either, but a non-smiley face one. Non-drug smiley face, which was, there are three big corporations in America who have decided, they're all kind of liberal leaning, decided that our healthcare system stinks.
It's expensive.
It's expensive.
I mean, compared to the rest of the world, our metric is terrible.
And our outcomes are the worst.
Health,
We're the worst outcomes in an industrialized country and the most expensive. And all that money is going into the pockets of these
specialists.
So, J.P. Morgan, Jeff Diamond, Warren Buffett, of Berkshire Hathaway,
Okay.
and Jeff Bezos of
Yeah,
Amazon.
the Amazon guy. Yeah.
So those three companies have decided they're going to get together and form their own health insurance. And that health insurance is going to insure all the people in their companies. And I think what they've said is once they get it right, they're going to get other people, other companies can buy into this health insurance. So they could, so if you, for instance, as an employer, want to give health insurance to your employees, you have an opportunity to give them this health insurance.
So I am an employer.
Right.
I am an employer, and I'm paying about 12, 14 grand a year for a family. And this year, the insurance company I was with, I was looking at the rates of things, and they were going to go up again. And I told my insurance company that, you know what, you're more expensive, and the plans and the coverage are comparable. We're going to switch and go someplace else. And they said, you know what, you're part of this pool of people. We've had you for years. We've seen what your demographics are. And so I've got, 6 employees that are on health care. And so what am I spending? About 80, 90 grand a year on health care. And I know Joanne never goes, and Scott had a heart attack, and even after all that stuff, in a bad year, out of that 90 grand, we cost the system maybe 20.
Right. You guys are good.
They're making a fortune on us,
Well, yeah, the insurance,
percentage-wise.
they're making money.
So for employers to be able to say, I've got a pool of people, and I'm going to self-insure, and I'm going to pocket some of that money myself, and I'm not going to pay.
But you're paying, though, you may not be paying for your employees, but you're paying for other people who I take care of, who spend hundreds of thousands of dollars
On
getting
specialists.
nothing out of the healthcare system, who we've talked about. You're paying for those people. So this health insurance is saying, well, we're going to be smarter than that. We're not going to do all that crap anymore. So what they did this week, which made me jump up and down, is they hired their CEO. And the guy they hired is not just a doctor, but he's a doctor I am totally jealous of. Like, I am more jealous of this guy. I used to hate this guy because I'm so jealous of him. Because he says everything I say, and he does everything I do, but he's successful. He's actually successful. Which if I knew.
Successful. You're making an impact at the local level.
A couple people.
He somehow figured out how to break through.
He figured out how to break through. He's a Harvard guy, and maybe that's my mistake. But his name is Atul Gawande, and most people who know him because he wrote a book called Being Mortal, which is a fantastic book about the fact that we are trying to create in our medical system something that's impossible, because we don't accept our mortality. So we're wasting all this money and all these resources just making ourselves more miserable.
Well, one of the metrics is half of the healthcare dollars spent in the last year of life, right?
So a quarter of all healthcare dollars in Medicare are spent in the last few months of life.
Okay.
Which is useless, and we know.
Well, you don't know when that year is.
We do.
We do. Okay.
As doctors. We know that, but the families and the specialists say, let's try this and that, Like I told you about the 95 who just got a valve replacement. I mean, freaking give me a break, okay? So anyway.
They survived the surgery.
They did. She did survive, and she said, the biggest, I said, how do you feel? She said, I feel good now because my surgery's over with and I'm not going to be bugged about it anymore. I said, how about all the other symptoms? She said, oh, they're all the same. Of course, but she survived it, so good for her. $100,000 later. A lot of people got wealthy. So anyway, this guy I quote this guy all the time. First of all, he understands that primary care has to be the center of any healthcare system. He thinks we are screwed. He's a surgeon, and he said he's embarrassed by how much money is put into surgery and how little is put into primary care. So he's going to change all that in his healthcare system. He's going to make it primary care focused. Okay. He also
and he's getting the federal government out of the way, and he's going to do it in a place where
no rules.
Private companies, it's his own rules.
His own rules. Second thing he's always said.
How does that work with regulations? Can a company just say, I'm going to self-insure and
create their own regulations?
That's good enough that because
Medicare is out of the picture. Medicare is what screws us all. Because
they're not old enough to be on Medicare.
Right. Medicare's regulations are often adopted by other healthcare companies because it's easy. This guy's going rogue. The second thing this guy says, I quote all the time, he says 40% of all healthcare outcomes are low value, which means they're low value, which means that they don't help anyone or they even hurt people. Yeah. So he says, and he knows what we all know what they are.
Sure.
Doing stents on people without symptoms. So he's basically this healthcare system is not going to pay for that anymore. If it's a low value thing and you want it, you pay out of your own pocket. That's going to save you as an employer a ton of money. So good thing happening
Yeah,
in the
what is a good
healthcare
thing?
system, and I'm going to be looking forward. Maybe, and, you know, I've been working through Medicare, and maybe
Yeah.
time to shift a little bit and see if private places, maybe other health insurance companies will go by this. I have total faith in this guy. So a tool, if I can call you that,
Yeah.
I'm willing to work. I'm willing to work with you. Give me a call. Give me an email. My email is going to be at the end of this podcast, and I'm with you. I quote you all the time, and I'm totally with you. And yes, we need a primary care based system without all the garbage that's enriching all these people. Let's
it seems like there's
let's
a
do
lot
it
of
right.
room.
Let's
There's a
do
lot
it
of
right.
room.
So you don't have to pay a lot of money,
Right.
and so my patients get better care, and so that I, as a doctor, can take care of my patients. Hey, so if you're equally annoyed by our dysfunctional healthcare system and all the garbage you're being fed, then give me an email, log on to my website, which is listed down here. Let me know what you want me to talk about, and I'll just keep feeding you information, and we'll discuss this and hopefully make some changes. See you later.